mentioned, want to make sure this is available to post to the website, and it's also great for our note taking. Okay, so let me pull up the whiteboard. Coming. And I will zoom in a moment, but can you all see a whiteboard? Okay.
Yes.
So the first thing I'm gonna do is first, I'm gonna have you follow me. I'm pushing a button in the top right corner called, that looks like an eye, and it's all eyes on me when you hover over it. And that just means that you're gonna be looking at what I'm doing on my screen. If at some point you want to be able to move things around and manipulate your own screen, you can simply stop following me and you will still be looking at the whiteboard. So it just means you're not seeing exactly what I'm doing. So for example, I'm going to start zooming in so you can see more closely what we're looking at here. And so that's what, you know, when you're following me, you can see what I'm doing on the screen. So just to, I'm going to focus in here on this red section with a little bit of an orientation on how to use the whiteboard. Okay, so let me start with, I'm going to start with these functions that you should see in your lower right corner, the zoom in and out, you know, so you can click on that plus sign or the minus sign to zoom in and out. So when you have control, you know, and you're not following me, you can zoom in and out of your whiteboard. There is also this little thing called a mini map. And when you click on that, it will orient you to where we are in the document. So if for some reason you get, I don't know, stuck on a sticky note, like way over in a corner, you can reorient to like where the group is. So we can see how useful that is, but just letting you know what that button means. And then there's also this little arrow button, undo. And so if for whatever reason you click on something and, you know, it adds a box or does something you don't want it to do, you can just hit that undo button. And meanwhile, you know, like I said, Christine and I are both here to help figure out, you know, how it's all working with the whiteboard. So then I'm moving over to, there's like a little panel of buttons here over on the left where you have the option to do a couple of different things. And so wanted to highlight that at the top of that panel is an option to click either a hand or this arrow. So you can sort of click an arrow and that allows you to go over and like if I click that arrow, I can go over to one of the sticky notes and double click on it and then start typing. So that's the function you're going to use when we take time and all of you take a couple of minutes to like write down ideas on these sticky notes, is you click that arrow and head over to that sticky note to type in some ideas. The other option is a hand, which is a grab function. And that allows you to click on the whiteboard and then move it. So like I can move the screen so we can move closer to the guiding principles. So, you know, I'm just over here in the cheat sheet to help orient us first. So those two are going to be important to use. And then a little further down, there's what looks like a sticky note or a little sheet of paper. And we have a bunch of sticky notes over here in the yellow area. But if we run out of sticky notes, you can click this button and add a new sticky note. And you can pick whatever color. So like I just picked yellow here, and I can add that yellow, like another sticky note over here and type in it. So if we run out of sticky notes, we can add more sticky notes, and you'll see there's a place over in the right side where we can put these sticky notes. So we can put them over here in this dotted area. Okay, and then finally, I think as you start working, you may see that you can see each other working, and that can get distracting because you'll see each other's cursors. And you might like it, but if it is distracting, you can go to this menu. And when you go to view, there's a bunch of options here, and you can decide or unclick collaborators' cursors, and that way you don't see everyone moving around the screen if that gets distracting. So that's a brief overview. Any questions?
Nicola, where's the menu? Sorry.
So the menu is in the top left corner. There's 3 lines. And when you click on that, you have those options. Yeah, you see that. All right, so I think what we're going to do in our breakout group is, as Jamie mentioned, we have, and I'm just going to grab and move over here to this first guiding principle. 1 second. So each breakout group is working on 3 guiding principles, and we have about an hour, but a little less now. So let's just say like we have about 15 to 20 minutes per guiding principle to work through the process. And so our guiding principles for this group are 1, people in crisis experience person and family-centered care. Just give you an overview of what we're going to be talking about. The second guiding principle is the crisis response system is coordinated and collaborative across system and community partners. And then our third guiding principle is the crisis response system is operated in a manner that honors tribal government to government processes. So I think we will start just here at the top with our guiding principle around people in crisis experience person and family-centered care. And as I'm gonna try to move this down so that you all, okay, great. So I'm not, nothing's blocking the view. And so, as we just did in the sort of large group, we, are sort of thinking about these 2 core questions. What does this mean in practice, that people in crisis experience person and family-centered care? And how might we measure whether this is happening? So one of our sort of thoughts on engaging some discussion around this was to give you all about 5 minutes to sort of add sticky notes, your thoughts on this. And then we can come back and talk together about sort of where everyone contributed and any additional ideas. And if you want to send something in chat, we can just add it in. If the whiteboard is not working or it's, if it's not working. So how does that sound to everyone to sort of have 5 minutes to fill this out? Sound good? Okay. So I'm gonna stop. Well, actually, if I'm presenting, you all can still get in here, right? As I'm presenting. Like, are you able to come in?
Yeah.
Okay, great. Yeah, so unless you want to have at, your own whiteboard access and control, you can just type in and add add your thoughts.
Nicola, tell me again the two things that we were looking at, per guiding principle.
Yes, no problem. 1 second. So per guiding principle, we are asking, what does this mean in practice? So what does it mean that people in crisis would experience person and family-centered care? Like, what does that look like? And then the second question is, how might we measure this is happening?
Thank you.
And feel free to let me or Christine know if you're having any trouble at all.
Yes, I am. Where am I typing? I am so confused.
Okay. Okay, you are, let's see. Do you have your, so when you go over to that left bar, do you have the arrow selected?
Yeah.
And then if you head over to one of these sticky notes, let's say the sticky note below advanced directives.
Yes, I found my sticky note. How do I make the font smaller? Because, oh, I just increased the size of the sticky note. Well done. Okay.
Oh, I see. So that's your sticky note right there. Okay.
Yeah, it's so big that I can't see it when I type on it. So
Let's see, Christine, are you able to get in and I can?
Yep. It should be able to just change the size of the font, if you add additional wording in. So let's give it a try here. What would you like to include?
I was just saying, ask consumer if they experience care centered to them. But as I'm typing, it's not getting smaller the way it was when Jamie was typing. Was adjusting in real time. Mine is not, so that's why I was confused.
Here we go. Now yours is.
Okay. Where? Okay.
I just moved it back into the frames.
Okay.
Well, you know what? And I will just move it. Christine, can you just move it back up into that guiding principle that we're?
You got it.
Thanks.
Oops.
Is it working better now, Vipasha?
Where, I can't find it, where is?
Yours is right here on the third row, second column. You should see me hovering over it.
Oh,
Oh, hold on, I've turned off the thing, so just a second. Where is your cursor now?
Third row,
Yeah.
second column. Ask consumer if they experience care to them. Unclear if that was your, if that's what you would like included.
Yeah, okay, I'm having a hard time. I'm gonna handwrite it in my notebook and then I can see it later.
that sounds great. Or you know what, Vipasha, if you just write it in a chat, we'll paste it in, if that works.
Thank you.
Yeah, thank you. Thank you for patience with us,
No.
this tool. Christina, it looks like the frame got moved to the left. Is it possible to move that back or?
Yes. Sorry.
And as long as you see your stickies in here, we can, as a group, sort of go through and clean it up, you know, and figure out where everything belongs, so.
I was working on it on the side and then the thing shifted. How do you find your sticky note again? I was in the middle of typing it out.
What I'll do is I will take all the notes if okay with those who are putting notes on the side, and I will drop them into a sticky note. And then you can go ahead and click that sticky note and just update it if that works.
Thanks.
Anna, are you able to find yours?
I can't find it. I'll just start another one. Oh, here it is. Wait, oops. Oh,
What does it say? You know, is it,
people in crisis are listened to. Okay, yeah. I don't know how to put it back.
we can put it where it belongs as long as the words are there.
Okay.
All right. So I think, does everyone need any more time for adding ideas? Okay, I think let's take a look at what we've got. Just do the grab. All right. So. All right, so you all can see my view, I think, and I am gonna select. All right, so can you all see okay? I'm scrolling in a little bit there, but here are our stickies. We had our example one, which I'm actually just gonna stick over to the side, okay? So I just wanna go over some of the things that we identified about what this means in practice.
May I interrupt for just 1 second? How do I go back to looking at your view?
A great question. So you can, I think over in that top right, toolbar next to the eye, you can click on the people, and I think there's a way that you can say, ask to follow or follow me.
I found it. Yeah, it's little
Yeah.
binoculars next to your name.
Oh, perfect. Good, thank you. All right. So in terms of what does this mean in practice? We've got, I'm just gonna move. Stickies over here. All right, crisis resolution is just defined by the person, family. This is super tiny, I'm sorry. People in crisis are listened to when they have a complaint or grievance about the care they received. People are not dismissed. I'm just gonna make that a small square again, but consumer satisfaction survey. I think this one goes over in the measures, so I'm just gonna stick that over here. Care is culturally responsive and language appropriate. Responders are trained in motivational interviewing. Caller defines the crisis and is given time to provide information. Advanced directives are followed in any crisis intervention. Thank you, Bipasha. I'll add that in. Responders are trained, advanced directives ask consumer if they experience care to them. Can we clarify that one? Ask consumer if they experience, how they experience the care, or is it, I just want to make sure I'm understanding the question for the consumer. Identify who are the person's viable natural supports. Explore various resources options that are available to see which one of the caller feels is a good fit. Being culturally active, not just culturally responsive within application. And families are offered resources for support. And I see there's another here that is just added. That is, people do not need to tell their stories multiple times. And then I know Bipasha, you added a couple.
So if something's being typed out, I don't see any of it. So what am I doing wrong?
Do you see my screen? Like, are you seeing me zoom in and out? Or I mean, it's not zooming in and out right now, but are you seeing? Like when I go, I'll zoom in. Did you see that get bigger?
No.
So when you go to the top right corner of the whiteboard. And Fennec, you can help me here. It's, you click on, there's a list and there's binoculars.
Yeah,
If you-
did that.
And that way you will see what I'm doing, or, you know, what my control of the screen. So I zoomed out, like it's smaller and now it's bigger.
Bipasha, if you look for Nicola's name on
Yeah.
the top right-hand screen, if you click it, you'll see her name, and there, like I should mention, there are binoculars. If you click that, it'll automatically go to her view. It'll say follow.
I can see that now. Where's the written content that you're typing? That's the part I can't see.
I am not typing anything right now. I was just reading the content from the others.
All right, thank you.
Yeah, yep. Okay. All right, in terms of how we would measure, we have a number of ideas here, and I'm not, yeah, so we'll just doing sort of the summary review. I see here, actually, there's, no, put this one over here. Um,
Nicola, feel free to let me know anything that needs to be moved over. I can quickly move it over for you.
oh, that would be great. Can you please move over the families are offered resources and support? Okay, in terms of measurement, ideas that everyone had are, families are offered resources and support. I think that would be over in the meaning group. Measurement idea would be documentation of client's resolution. Another one here is individuals are asked who they want to involve in their care. And this is, and providers have access to mental health advanced directives. So I think that is also, what does this mean? If you can move that over, Christine. People in crisis are listened to when they have a complaint or grievance about the care they received. People are not dismissed. So that is in the, what does this mean? Determination of whether a crisis has been adequately addressed is made by the person and family in crisis. I think that is what does this mean? consumer satisfaction survey. Percent of times individuals and families are asked about advanced directives and whether they were followed, and if not, why. Percent of follow-up calls are made to family and friends identified in advanced directive. Quotes from consumers or family members are within documentation. And again, consumer satisfaction surveys. And then I see here a note, family respite care options are available. All right, thank you all for, so any thoughts on what you're seeing on the screen here in terms of what does this mean in practice and how might we measure it happening? Any ideas that are missing or key themes that you're seeing through the sticky notes and ideas that have been shared?
I appreciate seeing all the pieces about advanced directives, and I think that's a big theme through here. And it seems like a pretty important piece of the system that would influence a lot of the other, all the aspects of care.
And I'm sorry, I also see I had a note, Bipasha, in the chat from you. I'm just gonna add these in. Clients rate whether they feel centered.
I had a question. I'm the one that put down the care is culturally responsive and language appropriate, and then someone else put that's culturally active, not just culturally responsive. So I want to learn what does that mean?
Does the person that identified being culturally active want to share sort of more thoughts on what that means? I think we'll have to hold on that one for now, Anna.
Okay, I just want to say that if my stuff isn't good enough, I want to learn more of how it can be better.
Yes, sounds good. I'll have that noted as far as that clarification needed on the difference or the intent of that. Okay, and all right, I would say we are in terms of sharing out for this guiding principle, do I have a volunteer who would be willing to do that in the larger group?
I can share this one.
Kristen, that would be awesome. Thank you so much. I
just want to say I really appreciate the person who put in the sticky note about people being listened to when they have a complaint or grievance and that they aren't dismissed. I like it really echoed some of the lived experience stuff that we were hearing earlier in the meeting. And yeah, I haven't thought about it in that way of being like a really good indicator. And yeah, I'm just really glad that whoever thought about that did.
We'll keep them. All right, everyone. Well, let's move to our next guiding principle. I'll move down to the crisis response system is coordinated and collaborative across system and community partners. And if you have any trouble typing in here, please just send a chat to me and I will type it in for you.
How do we move it down? Because I'm only seeing like the top part of it.
If you hold your right button down on your mouse, you should be able to maneuver throughout the page.
Is that working, Anna?
No. Oh,
If-
okay, I see it. Okay. Thank you.
Okay, so we'll do another 5 minutes here and then take a look together.
Hello, sorry for the late join. I had a conflict that I was not able to get away from.
Welcome, Dylan. Thank you for joining. So we are working on this whiteboard exercise where I'm not sure if you've ever done a whiteboard, but you can click on any of these sticky notes and add in your ideas to the questions that we are posing in relation to the guiding principle you see here on the left. The crisis response system is coordinated and collaborative across system and community partners. And if you want to just send a chat to me, I'm happy to type it in if that's an easier way to get the information in.
No, this looked pretty clear. I'm just gonna orient myself here by scrolling through a little bit of that.
Perfect.
Thanks.
Okay, another minute and then we'll sort of take a look at what we have. All right, does anyone want to volunteer to sort of share, read through what we've captured here in the meaning and measurement areas?
Nicola, can you go over, what does that mean? Are we just reading it to the group if
Yeah,
we
I think maybe just
volunteered?
reading it to the group, or if you all would prefer, you know, just reading it yourselves and highlighting some things that are jumping out or impactful to you.
I mean, I can volunteer for this one.
Okay, thank you, Anna. So you will, are you volunteering to report out to the large group?
Yes.
Got it. Okay, great. Thank you so much. So we have Kristen reporting out on the first guiding principle and Anna reporting out on this. I think for purposes of time, we have, we're gonna be convening again with the large group at 3:25. So we've got just about 5 more minutes. So I'm thinking, if you all wanna, move to the next guiding principle, or if you'd like to stay at this guiding principle and just identify some of the key themes that you're seeing here, up to you. Any preferences? I think then let's move down to the next guiding principle so that we have some time to gather your ideas. And I see I got some additional ideas in chat, so I'm gonna add those in as we do that. So, just moving us down to our next guiding principle, where it looks like we are, Christine, are you adding some stickies in here?
Yes.
Great. Okay, so this guiding principle is the crisis response system is operated in a manner that honors tribal government to government processes. So thoughts on this in terms of what this means in practice and how we might measure whether this is happening. And so I've got an idea in chat here that I will add, but if you all want to take a couple of minutes to add any thoughts here, that way we will have gathered your feedback on each of these guiding principles in this session. Okay. And I know we just have a minute or so before we are going to be moving back into the large group. So I see here some thoughts in terms of what does this mean in practice? Honoring tribal practices and knowing that there are differences among tribes. Operating procedures that are in place between tribes and regional crisis partners. Culturally driven care is centered. Oh, it looks like we have 10 minutes, great. Culturally driven care is centered and recognized as practice-based evidence-based practice. Identify the minimal but critical government to government processes that need to occur so that CRS can be successful. Staff are trained in culturally appropriate practices, and CRS here, is this crisis response services or?
Yes.
Okay, thank you, just making sure. Staff are trained in culturally appropriate practices and including regular review of government to government processes. Great. And then in terms of how.
Hey, Nicola, can I say something about just the second one down, when you culturally driven care is centered and recognizes practice-based evidence?
Yes.
I heard you reframe that to evidence-based practices, but a lot of times tribes will talk about their work as practice-based evidence.
Oh, so that was intentional. Thank you. Thank you.
Tribes would say that they've not been like many other populations, they've not been included in the evidence or what is done. So again, but they've got thousands of years of practice and other pieces for their culture. So often when we've done work with tribes, they will refer to that as practice-based evidence. So just wanted to clarify, it was intentional.
Very helpful. Thank you for clarifying that. And then we have in the measurement area, regularly asking tribal governments whether they feel these processes match their understanding and expectations of existing processes. Making sure we get tribal voices for lived experience and feedback. Have a forum where discussions can occur to improve services provided. And review government to government processes timelines met and signed off. I see there's great. So would anyone like to make any sort of general observations of sort of what we've identified here in terms of the meaning, or things that are standing out to you in terms of the meaning, and how we might measure how these things are happening? And I think my next question is, do we have a volunteer, someone who would be able to report out on some of the ideas identified here?
That's the first thing Michael did in his breakout room, Nicola, was get a volunteer.
Well, we have volunteers for the two other guiding principles.
Oh,
so
that's
we have
good.
my guiding principle. So anyone want to share out on the tribal guiding principle?
Nicola, while we wait for a volunteer, I just wanted to point out that you have an extra sticky here. Unsure where this one should go. The partners need to trust each other and not
Yeah,
need to
thank you. I was just gonna
resources.
put that above over here, just. Yeah. Into the guiding principle around system coordination. And it's probably over here, and what does this mean? But trying to fit everything in. Well, as you can see, I think we have a lot of ideas. This, I'm curious that this tool has been, you know, a learning curve for everyone, and, you know, including me. How, you know, I know it's been a little bit clunky, so I just want to acknowledge that. I really appreciate the flexibility that you've given to add ideas, and just reassure you that we will be making sure everything from the chat and you know, that all of the sticky notes here are organized as we work to bring together all the materials from the meeting. So right. Is there any particular guiding principle you would like to go back to, or um I'm just sharing here sort of where we are. We have Kristen reporting out on our guiding principle about people in crisis experiencing person and family-centered care. And then I'll move down to the crisis response system is coordinated and collaborative across system and community partners. And Vipasha, I see I have a chat from you that I need to add in here. But I'll just leave on the screen so you all can see what we've got. And I think we will be closing in 2 minutes. So any additional ideas or thoughts, please feel free to share those.
I did just add one to the on the top guiding principle here. I don't think I saw this, but the like some documentation or verification that the client agreeing with the resolution, or they understand the resolution. In a lot of cases, I've just seen where people just close out, just in customer service in general, people close out something and say it's done, and the customer might not be actually happy with the resolution that's being provided or not agree with it.
Thank you, Dylan. All right, I think we are being moved back in, so thank you all for your ideas here. There are a lot, so appreciate all of that work.